Hello friends, I am back again with new video on risk factors of cancer. So in this video, we will discuss about the risk factors which leads to causation of cancer. So before we move to the various risk factors, I would like to tell you what do you mean by risk factor. Like in communicable diseases or infectious diseases, we have a microorganism which causes the disease. But in case of non-communicable diseases like cancer, hypertension, diabetes, we have risk factors. So risk factor means a factor. If we are exposed to that factor, the chances of development of disease will be more. So the chance will increase. That's why it is said that it is called as risk factor, means it will increase the risk of development of disease. So in case of risk factors for cancer, you will see that people who are exposed to such factors are likely to have more risk of development of cancer. So let us see about the risk factors of common cancers. So coming to the first cancer, that is the lung cancer, which is very common in males. There are various risk factors, but I will say that the tobacco smoking or tobacco chewing is the most important risk factor in Indian scenario. So smoking cigarettes, at least 20 cigarettes per day over a period of 20 years will increase the risk of cancer if you are smoking. Then other is the second hand smoke. You are living in an environment where other people are smoking, that is called as passive smoking, that will also lead to lung cancer. Other risk factors are like exposure to radiation, aging process after 50 to 60 years, pollution in an area like smog means present of smoke and fog. Then environmental conditions like presence of radon gas. Then person who had history of COPD or lung diseases like coronary chronic obstructive pulmonary disease. Then genetics, anybody who's having family history is also a risk factor. Then who are working in the mining work, then those who are working in asbestos industry. So that leads to asbestosis, and then it may cause lung cancer. And finally is the tobacco chewing or tobacco smoking. So tobacco smoking is one of the common and major risk factor for lung cancer. There is another type of smoking which is called as chutta smoking, where we keep the burned end of the cigarette inside the mouth. So that will increase again the chances of development of lung cancer. So we should avoid these all these risk factors to prevent the lung cancer. Coming to the next cancer, that is oral cancer or cancer of the lip and mouth, which is also very common in our young Indian population. So reason behind it again is the tobacco chewing or betel nut chewing, and also excessive consumption of alcohol, excessive unprotected exposure to the sun, and low intake of fruits and vegetables. Our diet is always lacking in the fruits and vegetables. So all these factors, particularly the chewing of tobacco and chewing of betel nuts, gives rise to the oral cancer like gutka and kharra. These are the commonly consumed uh, things by the youth, and this cancer is very common in young generation. Now, next cancer is the breast cancer, which is very common in females. So it is said that those females who are obese or having body mass index more than 30 are likely to develop breast cancer. Then alcohol consumption, exposure to radiations, age above 40 years in female, and some genetic mutations, and also the history of cancer in the family in the form of breast cancer will increase the risk of development of breast cancer among females. Now, next is the second most common cancer among females is cervical cancer. So, the risk factors for cervical cancer are HPV infection, that is human papilloma virus infection. And this infection is very common among the females who are not maintaining personal hygiene and those who are having the weakened immune system. Then those females who are having multiple sexual partners are also likely to develop cervical cancer. Those females who are chewing tobacco or smoking, and those females who have given birth to more than 3 children are likely to develop the cervical cancer. Prolonged use of birth control pills also can increase the risk. then diet low in fruits and vegetables, and also the family history of cervical cancer in the previous generation. So these are all the risk factors for cervical cancer. Next cancer is the colon cancer or cancer of the large intestine. So this cancer is very common among the people, either male or female, above 40 years of age, who are using again alcohol and tobacco, those who are not taking high fiber diet, then there is a family history of cancer. Some people are having inflammatory intestinal conditions, they are at more risk of developing colon cancer, then lack of physical exercise. So these are all the risk factors for the colon cancer or colorectal cancer. Now, next common cancer among males particularly is the stomach cancer. Risk factors for stomach cancer are age 60 to 80 years, Helicobacter pylori infection. So this is another type of infection which is found in stomach. So those who are chronically infected with this bacteria are likely to get the stomach cancer. Then again, tobacco chewing, smoking, overweight, smoked and salted foods. Those who are using stored food, artificial food, and smoked food, that will lead to stomach cancer. And again, the family history of cancer in the family. Last is the prostate cancer, which is found in males. So again, you'll find that there is family history of cancer. Chances will increase. Then diet low in the fruits and vegetables, exposure to the chemicals, hormones like testosterone, male hormone. People are taking sometimes testosterone therapy. That will lead to the prostate cancer. Then aging also. Then some races and ethnic people are at the more risk of the prostate cancer and geographical area. In our India, prostate cancer is also one of the common cancer. Then some gene changes in the person can also lead to the prostatic cancer. That's why we try to find out prostate specific antigen in the blood of suspected cases of prostate. So this is all about the risk factors. I hope that you like my video. I request again, once again, please subscribe my channel, like the video and share the video. Thank you very much.